But it's like, so
And
but you've got to look at it.
That's under control.
Say, we've all represented industries before that have this,
so we're good.
that could buy and sell
How
data.
did that go?
And it's like,
One fun.
Well,
you just, you can't do it, it's like, yeah, it's just.
So we know that I like to be prompt. Are we recording?
Yeah.
Okay, I probably shouldn't use funny voice. All right,
Or maybe you should.
maybe I should. I don't know. It's been one of those weeks. I'm gonna call this meeting to order. Any changes to the agenda? All good.
All good.
All good. All right, and approval of the meeting minutes.
Move we accept the minutes as written.
A second.
Sorry, any discussion? All those in favor say aye.
Aye.
Any opposed? Anybody for public comment? Anybody in the chat room? Alrighty. No unfinished business?
No unfinished business at this
Are we
time.
not working hard enough?
We are.
Or maybe we are working
We
hard
are
enough,
finishing
yes.
business. Time to add a new project.
No. All right, we'll move over to
No.
Charlie. Thank you.
It's gonna be Amber today. Alright, so August financial reports. Alright, so we are 17% through the year. We have the bank balance of 572,000. With which is in compliance with our reserve amount by 141,000. Our revenue year to date, 242,000, which is 2% below budget. Salaries and wages, 198,000, which is 1% below budget. Operating expenses, 35,000, which is 6% below budget. Putting our current surplus for August at $8,000. Accounts receivable, we have 284,000, which 178,000 of that is the West Virginia Treasury.
A little bit of a preview, you'll see accounts receivable going down next month. And for West Virginia Treasury by about 40,000.
Isn't the other receivables over 90 days down as well?
From last month? Yes, I
Were there
believe so.
Some commercial payments coming in?
Both.
Yeah.
State and state grant reimbursements and some billing and some medical billing, yes.
That's great.
How does that break down?
How does it break down out?
I mean, in terms of vendors or if it's.
So vendors are going to be your big insurance companies. So Blue Cross, PEIA, of course, Medicare and Medicaid. Those are two of your biggest. And then the state of West Virginia is usually much bigger chunks, usually 5-figure, 6-figure chunks, as opposed to $60 and $90 and $120 chunks through healthcare reimbursement, healthcare insurance reimbursement.
Yeah, so any balances greater than 10% of your receivable balance, we report to you. All the small stuff, that's in that other receivable column. So the only big items in there are related to the state of West Virginia.
Is it unusual for them, for this number, the over 90 days to be as high as it is?
There are a couple, yeah. Yeah, actually, unfortunately.
Yeah, it's very
I would hate for it to be any more than, to be larger than this, but yes, that's not uncommon. We actually do have about a $75,000 pending payment from the state of West Virginia from fiscal year 23, so. And that's grant closures and things like that sometimes hold those up, and so they haven't decided to close that grant yet, and they held on to our payment. So this is our last billing cycle on the COVID grant. So But they've left those COVID grants open for another 2 years. And so they're not moving expeditiously on the final reimbursement for some reason. Wish they were. I pushed them on a lot and I've gotten a lot of that AR down on the West Virginia state side, but that particular payment is pending and that's what's really driving up that number, that over 90.
Health insurance has been a very small part of our budget in the past. It's increasing and breaking it out with the different payers of who's way behind and who isn't. We don't have that yet, but it's certainly one of our main goals this year is to get a better handle on that.
Yeah.
And fewer bad debts.
Yeah, we're looking at an aggregate on other receivables over 90. I'm assuming that's pretty much your commercial bucket on the other receivables.
Yep.
58.9 out of a total of 105. That's like a good stat to measure our performance on that is percent over 90. What percentage of your AR is over 90 days? And at an aggregate, it's 55% currently. So I think tracking that stat, monitoring that stat as you work to get more detailed payer level percentage breakdowns, I think it's a good place to be. And start.
Good way to
So,
focus.
Yeah, I'd like to start keying in on that number, like, what is your percentage of commercial AR over 90? Something to think about.
No, that's great advice.
Yeah.
You know, you do it all the time.
Yeah, and as far as collections efforts, is it the billing team doing collections efforts?
They are.
Okay,
And rebilling when necessary, things like that.
sure, and appealing when
And
necessary.
appealing when necessary, yes. It's not as easy in an organization like this. We don't have a billing, an individual who does just medical billing all day. That would be wonderful. We can't afford that.
Yeah,
I would love that.
yeah, maybe,
Maybe.
yeah. All right, thank you.
Just to compare, currently in August, we had an $8,000 surplus. Last year, we had a deficit of 60,000. So we're doing much better. This is most likely due to timing differences, decrease in vaccine expenses, and a slight decrease in salaries.
Any questions? Any other questions on August? Their motion to accept.
I move we accept the August financials.
Second.
All right, any discussion? All those in favor say aye. Aye.
Aye.
Ayes, Elliot's reflected. Thank you, Elliot. All right, we'll move on to September preliminary.
Right, September, we are 25% through the year. We have a bank balance of 516,000, which is in our reserve compliance by 148,000. Fiscal year to date revenue, we are 275,000, which is 8% below budget. Salaries, 311,000, which is on target with budget. And operating expenses of 50,000, which is 9% below budget. This leaves us a deficit of just under 87,000, which is mainly a timing thing. Some grants that were last year booked in September were booked in October this year.
That explains the low revenue.
Yeah, so we got our state allocation in October, that was $105,000. That'll reflect next month.
Yeah, and it's already deposited. So bank balance is more like 600 and something thousand, but
So will it
End
book to
of
September?
September.
Will it book to September or will it
No.
book to October?
It's October, it's a Q2
Got it.
allocation.
and then also you'll have Q2 billing for grants in October also. So October will be one of those where you have the month before running a deficit, but running a big surplus the next month. We've seen that go up and down. Very typical.
So it is the grant, the timing of the grants that has resulted in that 8% shortfall in terms of the projected revenues.
Correct. Yeah.
Okay, all right, thank you.
Yes.
Accounts receivable is down from the previous month to 223,000. 48% of that is the West Virginia Treasury up 107,000. It's about 78,000 or 70,000 lower. than the previous month.
So you'll see all the buckets current to 90-day buckets, those all have changed. But over 90 days with the state of West Virginia has not changed, and that was what Gino was alluding to a little earlier with some of those grants that are not closing out.
All right, any questions on September? All right, no other questions, we'll move on. Thank you guys.
Yeah, thank you.
Thank you.
Awesome. Thank you, Amber and Charlie.
All right, we'll move into the agency.
Not scary.
Yes.
We'll move on to the agency activity report. Brandon?
So I do one thing, the state of West Virginia, they're doing a public health risk assessment survey. They're basically trying to get every agency and organization in the county to do the survey. It's a Google Doc, and it'll ask you a bunch of, they say 15 minutes, I say 20 minutes. It's basically a whole thing will ask you, these certain events, what's the likelihood these events will occur in this county, more like your opinion rather than, if you have any evidence to back the opinion, then of course they have a place where you can add that. But there's basically those kind of questions and some other questions like that might not apply as much in Board of Health, which would be if you open a shelter and work with these certain organizations such as elderly, we're at risk, stuff like that, children stuff, and those kind of organizations. So I do have the QR code here. Only one Board of Health member has to fill it out, but if you've heard, the state would prefer if somebody from the Board of Health would be able to fill it out. Doesn't have to be today. We have to get in by the 24th of October. That's basically when they're locking everyone out. I've been spreading it around to other organizations, government and private. And basically, when you have time, just save it, fill it out. Only one person, if multiple Board of Health members want to fill it out, no issue with that as well. We just need one really though. But
Is it filling it out on
it's
behalf
on
of the
Google,
Board
it's
of
on your
Health?
phone, computer, whichever.
Yes,
one.
you'd be filling.
Yeah,
Okay.
on computer, yeah.
So do you have the answers written?
So it's,
Need the clip notes.
yeah.
Well, I mean, like, I don't wanna like, I don't want us to misrepresent,
No, yeah, no, I mean, it's pretty much there's no wrong answers. It's basically how you feel. It kind, and that's
It's opinion.
it's basically opinionated. And if you have any evidence, for example, like I said, basic questions like, have you opened a shelter in the last 5 years? Obviously, the Board of Health has not opened a shelter. So there's none of that.
How do we know that?
Well,
Because we would
you
have
guys,
told
you guys
you.
have, we have some new
We would,
members.
we would have told you.
Don't worry about it. But no, I mean, and
We would've
for.
asked.
There's a fancy trailer we got, so,
I mean, hey, we guys can open the shelter. But yeah, and then like I said, just, if you have worked in any average populations or any other questions, and there's instructions on the actual survey, it'll go a little more into details and definitions. So if you really need any help, and yet again, you can always reach out to me if you need any help or give me a call. And yeah, and so it's on the QR code here. I can also send you guys through email. But usually for make it easier for everybody here, just one person to scan it, that's it. And then besides that, there's really nothing else. I have next month, I have the conference in Colorado I'll be going out to. I think I should be here for the Board of Health meeting. But besides that.
You're elected to fill out.
No, I was gonna, I
thought you could delegate
somebody else
that
wanted
as
to
the
do
president.
it.
I thought that was some of the perks of the.
I just signed the check, somebody else has to do something else.
I do have a little paper for everybody. Thank you for waiting on me. I just caught up in some office stuff.
Okay, well, we're not to you yet, so you're good.
You're good.
All right, thanks, Brandon. Anything else?
That's it.
Okay, environmental.
Okay, so September was pretty average. Our food inspections were down. That's a 2-month average, so take that for a grain of salt on the side there. But I believe our 12-month average, if I recall previously, was around 30 or 35. The previous month of August included a lot of temp events, so those were the weekends. That's why that one was quite high, but 20 is closer to our target. We did see a lot of septics come in last month, so our sanitarians were doing quite a bit of on-site evaluations of properties and lots. We had 3 of us attend the West Virginia Public Health Association conference in Canaan Valley. It was fantastic. It was super informative. The sanitarians had a great time. I had a great time, got to network a little bit with some state officials, so it was good. Get Jefferson County's name out there. Still working on our statewide food handler cards. That was approved, but we haven't seen it go live on our website yet. So they took a look at the Board of Health ordinance and approved us for a statewide food card, which is fantastic news. It's gonna be the same price as our regular food card. So they were able to get that done for us. It's supposed to go live sometime next week. So I'll follow up, make sure that that happens, but.
Is it retroactive to current holders or is it when you get your new card?
Yeah, it'll be for new people applying.
Gotcha.
Mhm.
Is this a site that we're handling ourselves or is this something we contracted out?
It's actually the state's website that is offered for all West Virginia counties. I don't believe that we pay anything directly to them for them to manage it, but what happens is they take a cut of the food handler cards. So they get $10 out of every food handler card that is purchased through their website. So that's kind of the trade-off of using it. But that allows us to not have to do food handler cards on site as frequently, which is nice because it's kind of a.
Training, you mean?
Yes, sorry, food handler card classes on site, which is burdensome to have to do monthly with a small staff. So this is great. Anybody can get their card at any time. And it's been really good for the county to do it that way. So we're also sending out a customer service survey to all of our food restaurants. That's just to gauge an idea of how we are doing as a staff. We're hoping for a 25% survey response. Right now, the last time I checked, we were at about a 10% response, which is pretty good. We sent that out digitally through email this year to cut down on cost of mailings and whatnot, and also staff time, printing and stuffing envelopes and stuff. So it's already sent out and we're already receiving responses. So I'm super happy about that. But other than that, pretty much business as usual over in EH, thankfully.
How many food service sites do you survey?
250. We sent it out to 250 restaurant managers. That is not all of the that's not all of the food facilities that we permit, but some of the owners own multiple sites. So we wanted to make sure that they only got sent one survey, so we weren't spamming them, a bunch of times. So 250 emails went out with the survey.
Will you be doing a second request email?
Yeah, we're gonna do a follow-up, probably in about 2 weeks. The survey is gonna close at the end of November. And we're hoping to have the results tallied around sometime in the beginning of December. And then I also printed out a QR code for the inspectors to hand out whenever they do the inspections. They're a little nervous about that, but hopefully that'll make them, be, super good customer service when they're doing their
I'm sorry, we
inspection.
have to close you down, but we're going to smile.
Fill out our survey.
Yeah, fill out our survey, I do.
Yeah, so if there's some outstanding negatives, well, take that with a grain of salt.
Are you gonna do something similar with the well and septic side of the business too?
Right now, well and septic, I'm really trying to do more educational stuff. So we just had a homeowners class that we partnered up with the town-run watershed, and I went out and spoke to about 45 members of the public came out to that, and there were so many questions. We had an incredible response. So seeing how many people came out made me realize the need for education in our community. So I think what I'm going to do in the future is partner up with other regions. I'm thinking next would be Harper's Ferry, because we have a lot of people that live there that are on septic systems and private wells that just might have questions. So my goal is to just get my face out there and make me approachable for people to bring their questions to. But I handed out business cards to all 45 people and followed up with all their questions and sent them some resources. that were requested. So a survey might be good for our installers. So that's really where our customer service kind of comes, where we make appointments with them and we really deal directly with permitting questions with the installers specifically, not too frequently with homeowners, but.
And on your, the complaints and denials in the
Mhm.
septic space, or what's the general, like what happened there, or what's going?
So, the denials are still coming in. And a lot of that is due to the decrease of usable land. As our county continues to grow and expand, there is less land that is able to be used for septic systems. So we may start to see that increase. We're trying to get creative with how we approach it. We had some really good conversations with the Office of Environmental Health Services this week about thinking outside the box and ways we can kind of present different options to our builders. So that's something I'm trying to look at. You know, it's not something we love to do. We hate giving out denials, but we do have alternative options that are working really well right now. Our alternative permits are very rarely denied to our public. The only problem with that is there's an increased cost for the homeowner to go the alternative route. So, you know, we really try to find a workable solution before we jump to the alternative permits, if we can.
So just in a general sense, in August, you had 6 denials.
Mhm.
Now, are those denials that were denied for anything, or does it mean class 1 denial?
Yeah.
And then they go on and get a more complicated system?
Right, that's
So they still get
specifically,
something.
that's specifically for the class 1 permit. So the class 1 can be denied for so many reasons. You know, it might be a space issue. It's most likely going to be the soil though. The soil in Jefferson County is really high in seasonal groundwater tables. So when our inspectors go out, they look at that, and if they see those water tables running through, then they have to deny that. And a lot of times we try to get second and even third opinions before we officially issue that denial. So, and we really try to bring the state in to work with us, because we do have a certified soil scientist at the state level that does a really good job at educating about these lots. So he has a lot of experience and it does a really good job at explaining to us how to know if it's suitable or not. But yeah, you know, it's something that's coming our way, these denials. The more growth that this county sees, the more that we're gonna have challenging situations come up in the septics. We're really trying to push the idea of the counties increasing the supply of public sewage that can increase through, so that more citizens can hook up to it.
Any other questions? Okay. All right, clinical.
So for this last month, things have been steady with vaccination and all our other programs. What has been a good thing is we've had more vaccine clinics. So for this month, we've done 4 vaccine clinics, including Job Corps, City of Charlestown, USDA, Bank of Charlestown. Plenty of vaccines going out. There's more requests for COVID and flu vaccines. So we've been doing that. We also went to Asbury Church. Last weekend, we had a great informational session. Dr. Reedy had a presentation. We had quite a few people ask for Narcan. Our Narcan efforts and distribution is also doing pretty good. More people are asking for it. And we have more clinics coming up. We have at least 2, one tomorrow and one later in this month. So it's been pretty busy for the clinic side with vaccine distribution in the community. And we've had home visits too. Our Ardith, our nurse, she goes to homes. She gives out home. There's been more increase in request for that as well, so. Yeah, we're doing really good. We're also communicating with the schools and trying to make sure all the children have their vaccines on board, and working with the school nurses, trying to communicate with the parents, because there's still sometimes parents calling and being misinformed of how the communication between school and us happen, because some kids are still unable to go to school because they haven't received their vaccines, even though they've been notified for more than 2 months. So we still have those hiccups and we're going through them. So we're still working with the school nurses to make sure communication is all smooth and easy. With QRT, we're doing really well. Peer recovery coaches are less and less in the office. They're more and more out in the public. Today, they have multiple appointments with participants back to back. I just was told I may not see them today, so that's good. I mean, they're out there, they're really working and meeting up with people out in our communities. And then I did want to touch on, this month is Breast Cancer Awareness Month. Today, we're celebrating breast cancer awareness. Everyone in the office is in pink. Just want to let you know, please share the information with your family and friends.
We have buttons if you want.
Yes.
I have a couple questions.
You
Yeah,
should let us know ahead of time about the pink.
yes, you should have.
Go ahead, Elliot.
Okay, about the vaccines, just a couple of questions. First of all, it says 0 COVID vaccines administered in September. The reports coming out, some of them are pretty alarming as to the effects of the COVID vaccines over time. But the questions I have, because you had said that people have been requesting COVID vaccines, but I see there's a big 0 there.
So the COVID vaccine requests have been happening for at least 2 to 3 months now, but we didn't have the vaccine in yet. The manufacturing agencies weren't able to start providing them until late September. So we
And
couldn't even get an order in until late September. So
Okay,
waiting
which vaccines are on order?
right now, we have the ability to give Moderna and Novavax.
Okay, so Pfizer's not in the picture. Okay. Now, with regard to the other vaccines, 151 childhood vaccines administered. How many are on the schedule currently?
How many are on the schedule?
Right. How many vaccines are children required to get into school?
It depends on what age group and grade they're in. Every age group has a different requirement.
Okay, so to enter kindergarten, how many vaccines do you have to get?
I don't have the number off the top of my head.
Okay. With regard to other vaccines, what vaccines are those? The 30 that have been administered in September?
The other vaccines, they may
Yeah.
include travel vaccines.
Like what,
Yellow
smallpox?
fever and all of that kind of stuff.
Do you know which ones they are?
So different vaccines that are given could be those people traveling, typhoid, yellow fever, hepatitis A, hepatitis B, the meningitis vaccine. Those are also given to some of them, like the meningitis and hepatitis A and B, are considered childhood vaccines that they're routinely given. Tetanus vaccines. Which
Yeah, that would be in the childhood vaccines. I was just curious as what comprised those 30 vaccines under the category other.
Majority is travel vaccines, but we do have occasionally adults coming in and getting what you normally would see with children, like an updated tetanus shot. And there are adults who still need MMR updates. I don't have the list exactly what we gave for last month, but there are adults who still get other than travel vaccines.
Okay, I mean, in future reports, if you had some of the detail, I think that would be interesting at least. So, but thank you.
Anything else?
That's it.
Any questions? Actually, I have one question. So in sort of in the category of other vaccines, does that also include things like shingles and
Yes,
so stuff that's sort of maybe the older population, not
Yes.
required, but people come in, so we do provide things like shingles and what's the other one, pneumococcal.
pneumococcal, yeah.
Okay, gotcha.
Thank you, Karen. That's exactly the question I was trying to ask.
And I almost said the word pneumococcal properly, but I stuttered, so.
You said it correctly there.
There we go.
Right.
All right, thank you. Health officer.
So I do not have much new to report. They continued, as you say, with the vaccinations. So the COVID vaccine now is going to probably fall largely to a flu, fall vaccine like the flu, just because it's kind of easier to think of it that way, but also the larger peak of the COVID infections and hospitalizations seems to be in the winter months of December and January. It's not seasonal like the flu in that we do see this throughout the year. There wasn't really a peak through the summer, but it continued. There are low number of hospitalizations and deaths, largely, as it always has been, in the older or disabled age group. So the main target group are the people who have weaker immune systems, mostly because of age, but others. And getting a booster can be helpful. The reason we didn't have any COVID vaccine for several months is because the prior ones had expired, and the only ones available for the last few months were the newest variants. So like the flu vaccine, it changes every year based on what the predominant, the most recent mutations are. So next year's strain will be slightly different, just like the flu is, based on whatever mutations are going on. In the future, there might be a combined flu and COVID shot, which is commonly done with a lot of other vaccines. The childhood vaccines, a lot of times, to decrease the number of injections, there could be 4 or 5 different vaccines in one syringe, and just to decrease the number of needle sticks. An awful lot of people are still getting COVID through the year. And in those cases, that can act like a booster of the immunity. And people who have had COVID, who want a vaccine, we recommend they wait at least 4 months after COVID. It seems to be that delaying the vaccine that long gives a better benefit. So that's the reason we didn't have any. We were hoping to get it, but there were delays. The Novavax is made by a more traditional vaccine technology, not with the mRNA. We were going to just get that, but it was delayed by several weeks in coming in. So we got the Moderna as well. The only reason we didn't get the Pfizer is we just don't need 3 different varieties of the same thing. The Pfizer and Moderna are very much the same. And we just can't stock all of them. Unlike before, during the pandemic, these are not supplied to us free. We have to buy them for more than $100 a shot and then get reimbursed for them. So if we order 50 vaccine doses, that's an income, delay.
Right.
As opposed to like the yellow fever vaccine for travelers, that's several $100. and rabies vaccines for the occasional people that need that, that's also several $100s. But those are small volume ones. As Lindsay said, the opioid overdose is a big it's taking a lot of our attention now. And we hope to expand that as money becomes available and the opportunities there.
Any questions?
Thank you, Dr. Reed.
Thank you. All right, Gina.
So quickly, we've interviewed we're interviewing candidates for office assistant 2 position at the front desk. That's still open. Hopefully we'll be able to land a new employee there in the next week or 2. And the really big news from my side is that we have applied for the West Virginia First Foundation settlement money that is available. We also applied to the county of Jefferson for their settlement funds too, and we did that in conjunction with a lot of with at least 3 other community partners. And I think we have a good shot at getting a good bit of either one of those and possibly a little bit of both. And what that will do is that will continue to bolster our QRT team, allow us to expand a little bit there, and also it'll get us into the group of people who are doing this and make sure that we're integrated in the system that's being set up in the county to help deal with a lot of the opioid overdoses and those types of things. So hopefully we can save some lives, and we've already saved a few. Hopefully we can save some more. That's all I have. And quickly for Dan, as these 3 well know, the overwhelming majority of the revenue cycle is backloaded to the end of the fiscal year. So when you may see some negative numbers the first half of the year, that begins to flip from March going into the end of the fiscal year in June 30th. So don't be too nervous.
Thank you.
You're welcome.
Big part of that being the environmental or the
Permitting
fees
fees
for permanent food establishments falls
starts in
the
March.
cycle starts in July, so they've already been permitted before July 1st.
Right.
But they don't pay it till the end of the fiscal year. So but we show that as an expectation. That's
Thank you.
100,000.
That was one of the worries my first year. I was like, what's going on? How come we don't have any money? And then I looked at how state aid is set up. So state aid is set up where you receive 38% in the 4th quarter payment, 30% of the total, 38% of the total comes in that final payment. So you may get $95,000 for Q1, but then you get $138,000 for Q4. So there's a lot of that lags, and then of course permitting also. So we do have permitting in November for end of calendar year permitting, but that's not the bulk of it.
It's a very small
Yeah,
amount.
the fiscal year is the big one. So that's really from March on is where we generate most of our revenue.
All right, so the next meeting is November 8th. I actually won't be here. A big work event in Las Vegas. So no offense, I have really long days, so I'm not getting up at 5 a.m.
We understand.
All due respect, when I'm in California, I do, but I will not do it in Las Vegas, so.
Unless you're already up.
Well, you know.
That should be interesting.
Exactly.
Could be one of those.
I left those
Did
behind
you
in
get
my
up early?
20s.
Oh, no. Staying up late.
I'm way too old for that. Karen in her 20s, perhaps. But so I'll leave it in the good hands of Brandon to manage the meeting, so.
We'll see you next year.
Yep, well, are you gonna cancel December too?
Oh.
It's all on you to commit, because I was
Oh, I
clearly
might.
really
Well,
bad at it last time when
yeah,
I tried
yeah,
to
it was
cancel, so.
Well, that's right.
We did.
You couldn't convince the staff to agree with you.
Yeah, exactly.
We wanted to have the board meeting,
Yeah, we didn't have a December meeting last year.
Yeah, I
right?
don't think we did either.
No, we did.
Yeah, we did.
So the book's already cooked in Brandon's favor. Way to go, thanks.
I'll show you how it's done.
Touche, well played, well played. All right, is there a motion to adjourn?
So moved. Second.
All right, we are adjourned. Oh, sorry. All those in favor of adjourning? Aye. All right, we are adjourned. Thank you.
Thank
Thank
you.
you.